It's a great honor to be invited here this morning as Minister for Health and Medical Services to address you all on this historic occasion. Historic occasion when we receive this magnificent asset that will be of use, great use to all the people in the West Division at the occasion of the official handing over of the new Western blood donation bus from the Embassy of Japan. The government of Fiji's goal for health is to provide a quality, affordable, and efficient health service for all the people of Fiji. There are two basic policy objectives to this goal, and they are that communities are serviced by adequate primary and preventive health service, and that communities have access to effective, efficient, and quality clinical health care and rehabilitation services. All units and departments are focused in organizing and planning out on strategies to undertake in order to meet these objectives. The Fiji National Blood Service continues to strive for improvement in trying to maintain a satisfactory blood level in our various hospitals daily. Blood is a vital component for saving lives in our hospitals. Blood is not readily available. You can't buy it in the supermarkets or in the hardware shops, but it is only available in the bodies of our people in this country. Therefore, this unit depends on the willingness and availability of blood donors. A global consultation on 100% voluntary, non-remunerated blood donation that took place in Melbourne, Australia in 2009, organized by the World Health Organization, based their discussion on the World Health Assembly resolution on utilization and supply of human and blood products, which urged member states to promote the development of national blood services based on voluntary, non-remunerated blood donation. The Melbourne Declaration recognized that safe blood and blood products is a critical aspect of healthcare. It also recognizes that regular voluntary blood donors are the cornerstone of a safe and sustainable national supply of blood. However, the call for action to all governments is to achieve 100% voluntary, non-remunerated donations by 2020, and that is the target. Fiji has now achieved 87% voluntary donation in 2014. We're almost there. Fiji should be achieving the 100% target in 2018. Achieving this target can only be made possible if resources and necessary policies are made available. The first blood bus donated for the Central Eastern Division by the Embassy of Japan was received in June 2009, and for that we are grateful. This has really boosted the level of voluntary donation in the division by 31.4%. In 2009, the Central Eastern Division achieved 62% of voluntary, non-regulated blood donation, and by 2014, it has increased to 93.6%, almost at the target. One major contributing factor is the availability of the blood donation bus donated by the Embassy of Japan, and also the training that was conducted using the WHO training manual. For the Western Division, 72% of voluntary, non-regulated blood donation has been achieved. This is an increase from 31.9% from 2009 to 2014. Although a blood truck was available, but it was not effective due to its status, it was not fully operational. This does not hinder the Western Division's effort in the continuation of mobilizing blood drives. Today, the kind donation of this blood donation bus from the people of Japan for clinical service delivery, especially to the blood donor recruitment program, is a timely donation. Modern technology is a timely donation and augurs well with the Ministry of Health and Medical Services endeavor to reach the 100% voluntary non-remunerated blood donation in 2018. The government of Fiji wishes to acknowledge with great appreciation the goodwill of the government and the people of Japan in this tremendous donation. The Ministry of Health assures you, sir, that this donation will enable our blood service unit in increasing their blood drive campaign in the Western Division and can be counted as one of the countries, so that we in Fiji, with your assistance, can be counted as one of the countries that achieves 100% voluntary, non-remunerated blood donation in 2020. This project is again evidence of the continued goodwill between the governments and the people of Japan and Fiji, and we look forward to further collaboration for health in the future. And we also look forward to our collaboration on the project for non-communicable diseases that we have. It's interesting, as I was driving up, in this project we're talking about providing blood. The other project that we have with the government of Japan is non-communicable disease. And a lot of that was making sure that we have the right things in our blood in terms of what people eat. So it's all about blood day to day, making sure that blood is available, making sure that people have good things in their blood. So thank you again, Your Excellency, for this wonderful donation, and I commend this bus to the people that will be using it out here in the West. And I commend also to all the people in the Western Division. Please give your blood, donate your blood, so that you can make a change in the lives of people that need this blood for the purposes of the health. And here we go again. Thank you, Excellency.
Thank you, sir.
I wish to thank the Ministry of Health for the warm welcome extended to me and to my colleague. Today I'll be handing over a new blood donor bus to the Fiji National Blood Service. The government of Japan has provided funding worth 165,000 Fiji dollars for this new bus. This project is implemented under Japan's Grant Assistance for Grassroots Human Security Projects Program, or GGP in short. The existing blood donor bus was in use for 34 years and eventually declared unfit by the authorities. This void was being filled by available Ministry of Health vehicles. In this regard, priority is usually given to other tasks of the hospitals, and the blood collection activities are set aside indefinitely. This leads to shortage in the hospital blood banks, significantly raising risks for those needing blood transfusions. The authorities try to cope by asking relatives of the patients in need to donate blood. I'm delighted to say that the new specialized blood donor bus will strengthen the blood collection capacity of the Ministry of Health and ease the strain of medical professionals. Most importantly, it will contribute towards maintaining a steady supply of blood for the benefit of the people in the Western Division. In many cases, this can be a matter of saving lives. The World Blood Donor Day, celebrated by the international community on 14th June every year, is a clear indication that donating blood carries global importance. Donation of blood is one of the finest examples of humanity. Through this act of kindness, we give part of our living being for the collective good of fellow human beings whom we do not even know. In order to tap into this goodness within the people, the new blood donor bus will help the authorities organize regular blood drives. In the midst of their daily lives, it is quite challenging for people to go and donate blood at the hospitals. The new blood donor bus will elevate the outreach function of the Fiji National Blood Service. It will help in effectively taking blood drives to the people in places such as shopping centers, markets, parks, institutions, and industrial centers, etc. The specialized technology and inbuilt equipment of the new bus will also make the experience of donating blood easier for both the donor and medical attendants at hand. It is also encouraging to see that this project is aligned with the Fiji Health Ministry's national strategic plans. The implementation of such assistance in line with Fiji's development aspirations is fundamental to Japan's Development Corporation. I take this opportunity to highlight that since 1990, Japan has been providing assistance to grassroots communities in Fiji through 332 GGP projects, with a total value exceeding 18 million US dollars. Japan is committed to providing assistance for the new phase of nation building of Fiji. At this juncture, may I compliment the work ethic of the Western Division Blood Service. Soon after its inauguration, at 12 noon today, the new blood donor bus leaves for its first blood drive at the Fiji Sugar Corporation premises. This is a dedication we and the entire nation want to see. Congratulations. I conclude with confidence that this project will further strengthen the progress of the Fiji National Blood Service in achieving its 85% of voluntary blood donation by 2018 as a practical pathway towards attaining the World Health Organization's target of 100% voluntary donation by the year 2020. Thank you. Vinaka Bakarev, Dhanyavad, and arigatou gozaimasu.
Thank you very much. Fred?
Thank you.
Ele sentando de menos.
Don't mucho nganggur.
Downstairs, does your...
Yeah, downstairs. When we get put our blood bags, it's just automatic. Just a line to the engine.
This is the start.
That is where we put our blood.
So how many people can sit in front there?
Three.
Very efficient. Yeah?
And with the bus, the interview room for our donors, where the nurse will sit together with them.
Naka.